Even though I'm not on here.
We're gonna try this.
Okay.
I don't know if it's gonna work.
Okay, welcome back. We will move right along to resolution 2021-06, approve of gift grant or donation for Lake Monitoring and Protection Network. Mr. Fisher.
I made a motion before, it hadn't up there, and I see now it's off, I changed it. But anyway, we'll go to line 14, the Soil and Water Conservation Department has received a lake monitoring and protection network grant from the Wisconsin Department of Natural Resources, in the amount of $12,371.23. And go down line 26 of resolution 2021-06. Now therefore be it resolved that the Door County Board of Supervisors does hereby accept the WDNR LMPN funding of $12,371.23, and it will be overseen by the Soil and Water Department and with the committee as an oversight.
Any questions?
Oh, and Aaron's here if you want any more specific information on it, but
Nothing? Okay, we will go to the voter board. I'm sorry. Sorry, Alexis, go ahead.
I guess I just have a question, specifics. Is this like a Clean Boats, Clean Waters program, or is it above and beyond that?
I didn't quite catch that. Is it Clean Boats, Clean Waters?
Yeah,
or-
is this Clean Boats, Clean Waters, or is it above and beyond?
So this contains additional activities beyond the Clean Boats, Clean Waters program. It helps support outreach and education efforts related to a variety of aquatic invasive species. So training, one-on-one outreach. Sam has done a great job modifying our outreach activities in 2020 to account for in-person restrictions, and this will allow us to continue that work.
Thank you.
Anybody else? We'll go to the voter. That's passed with a vote of 21 yes, 0 nay. Thank you. Resolution 20-21-07, approval of Wisconsin DNR Targeted Runoff Management TRM Program Grant Award to Soil and Water. Mr. Fisher.
Mr. Chairman, if you go to line 13, the Soil and Water Conservation Department has been awarded a small-scale water quality targeted runoff management program grant through the Wisconsin Department of Natural Resources for the Twin Harbor Creek headwater protection in the amount of $220,000. And go down to line 33. Now, therefore, be it resolved that the Door County Board of Supervisors does hereby approve the acceptance of the Water Quality Targeted Runoff Management Program totaling $220,000. Be it further resolved that the aforesaid grant and donation will be administered by the Soil and Water Conservation Department, subject to LCC oversight.
Any questions? We will go to the voter board. While we have Aaron here, we're going to move down to one of the special reports, the Door County Private Well Monitoring Program for 2019-2020 results.
Thank you for the time on the agenda. Can you have the presentation?
Yep.
So just while we're getting that pulled up, I was asked to give an update on the results of a private well monitoring program that we are working collaboratively on with the University of Wisconsin Oshkosh. Looks like you could see both my slides there. So I just want to remind you that this is a priority for us. Groundwater protection has long been a county priority, and keeping public focus on understanding the importance of monitoring their wells and understanding Door County's groundwater quality fits right in with that priority. It is a cooperative effort with UW Oshkosh. We could go to the next slide, please. With funding through the county levy, partially to fund their time, but also provide incentive for people to participate in the program. UW Oshkosh does the majority of the project organization and outreach efforts. They do the lab analysis of the water samples, and they're really the public face of the program, interacting directly with the people who sample their water and hosting the educational forums that are part of this project. I mentioned it's a cooperative effort also with Door County Public Health. Sue and Chelsea were instrumental in getting the program off the ground in 2019, and we appreciate any time that they're able to spend on the program now that their attention's been diverted to important other things. And then Soil and Water Conservation Department, Beth has provided administrative support for our office. Brian Forrest is working on technical aspects of the program, and I've been involved in the project planning as well. Most importantly, study participants. I just want to recognize and acknowledge the fact that we wouldn't have data to be talking about today were it not for the people who came to the forums, learned how to sample their wells, and participated in the study. And it's really important to recognize their contribution. So the goals of the program were twofold. One was to educate people about the importance of routine monitoring of their private wells. So often, when I talk with people, I find that they tell me, we had our well sampled once at the time we bought the house, the water quality is great. Here in Door County with our highly variable and sensitive groundwater, it's really important for people to understand that annual testing of bacteria and nitrates at a minimum is important. But the second goal was also to build a groundwater quality database for the county. The way that we structured it allows for us to have consistent assessment over time so that we can look for trends in our groundwater quality. When we understand better the variability and the nature of our groundwater, that helps us understand how to protect it. Next slide, please. So in the fall of 2019, UW Oshkosh recruited participants through a press release and a targeted mailing. You can see the photo on the right shows a picture of the educational forum that they held at Crossroads. Just incidentally, it's something that looks a little foreign to me now to see all that many people side by side attending a presentation. But essentially what we did was we had online registration and offered a discount to one well per section in the county. A section is 1 square mile. Looking to really increase participation countywide so that we could see how groundwater quality is across the county. We had people come and pay in person, pick up their sampling kits, attend the forum, and then go sample that same weekend and drop their samples off. That allows for us to have everybody sampling at the same time, reducing some of the variability that can be associated with groundwater data. Next slide. In 2020, we modified our plans a little. Initially, we had planned to conduct a spring sampling in April. We did not. We postponed that to the fall, and actually that was a good thing. So now we have consistent fall sampling structure. We adjusted to account for COVID-19 recommendations. We used a similar recruitment as before, but we extended the sample discount to everyone who wanted to participate in the program. This allowed for us to do registration and payment online and really simplify and streamline the program, which is what we needed. We had virtual forums. People could come and participate through their computer. Sampling kits were mailed to people rather than having them come and pick them up. And then the picture that I've included on this slide is just the map that we had for our contact list drop-off. So we're getting pretty good at doing this kind of stuff now, where people drive through, and in this instance, they were handing the samples off to Oshkosh. We had almost double the participation in 2020 than we did the year before. And I think the streamlined program was well received and something that will continue in 21. So to walk you through the results of 2019 and 2020, first I just want to orient you to what the table is showing. So then we'll take a look at each row. Our sampling effort focused on bacteria, both total coliform and E. coli. Nitrates are also another common parameter sampled, and those tests are recommended annually for each well. So on the left column, you will see the parameter name, and then underneath it, the standard. That's this human health standard that's set, the limit. And so for bacteria, it's 0. You don't want any bacteria in your water that you're drinking. And then you could see the parameter standards for the second column is the 2020 samples, the percentages that are over that standard. And that's one way of looking at the data, is how many results exceeded the standard. Likewise for 2019. And then the rightmost 2 columns are percentages from other sampling in Door County in prior years, and then the state as a whole. Not directly comparable, but just benchmarks for you to keep in mind as we go through. So bacteria. Coliform bacteria are naturally occurring in soil and in the environment. And so while they don't necessarily cause illness in healthy individuals, they're an indicator that there is potential for contamination in that water supply. So the standard, of course, is zero. Given the variability in water results for a whole bunch of reasons, I wouldn't necessarily try to look to 14% compared to 16% and say there's anything different. Those are essentially equivalent results. So one thing that you could take away from this is that our level of total coliform contamination is relatively consistent over time in the 2 years that we have the data for, but also with previous sampling efforts. E. coli, that's a more serious concern. E. coli can cause illness and is definitely an indicator of fecal contamination in the water, whether it be from human or animal waste. We had 2 of the 295 wells tested positive for E. coli contamination in the fall of 2020 and none in 2019. So while it's definitely important for those well owners that have those positive results, it is, and overall, there were low levels of bacterial contamination in the lab samples. The next row is for nitrate. And nitrate is a water-soluble molecule that forms when ammonia or other nitrogen-rich sources combine with oxygen. So if you think of natural background level would be 2 milligrams per liter, the human health standard, though, is 10. So you could see the 2020 results. We had 1% of the samples exceeded that 10 standard for nitrate. We'll look in the next slides at some of the variability in the data. There's a lot of difference between 0 and 10, but as far as exceeding parameters, 1% of the well samples came back exceeding that health standard for nitrate. Arsenic is the next one. That's a naturally occurring element in soil and bedrock formations. Traces can be found in groundwater and other natural environments. There are some counties in northeast Wisconsin, mostly Outagamie, Winnebago, and Brown counties that have rock formations with naturally occurring arsenic that can cause high levels of arsenic in the wells there. Here in Door County, not so much. We do have historic lead and arsenic mixing sites from former orchard practices that exist in Door County, but along the bottom row, you'll see the results that we obtained from the arsenic sampling, low percentages of the wells exceeding that human health threshold. Anyone who does have a well that exceeds that threshold should definitely pay attention to that. Arsenic contamination in your drinking water is a serious health concern. So now we're going to switch to some maps that show the range of results, not just the exceedances that I talked about in the previous table, and where in the county those results were from. So here our emphasis was on spatial distribution. We wanted to get a good variety of samples across the county, not just focused in one area. And we had a really lofty goal. I recognize that was a lofty goal to get one sample for each of the 619 samples in the sections in the county. we do have fairly good spatial distribution. And as we continue in future years, I'm really hoping that we'll be able to fill in some of those gaps. You can see in the center of the county, there are still some gaps that we'd like to target. We do have clusters of results along the shorelines, and there's a couple of reasons that one may think about related to that. It could be the way that people heard about the program through property owner associations, but also just the density of wells that you see with housing developments along the shoreline. So next slide. So bacteria, this is our total coliform results for 2020. We have similar maps that Oshkosh generated for 2019, but they tell a similar story. So for simplicity's sake today, I'm only going to share with you the 2020 results. And if I didn't already give credit, I certainly want to give credit to Oshkosh for generating the table and the maps that you're seeing here today. Let's see, the table in the blue bar on the left shows the percentage of the 295 samples that were in each of the result categories represented by the different colored dots on the map. So following what's a standard color ramp, green is good. The darker the color, the more bacteria are in the samples. Of course, our standard for total coliform bacteria is 0, and any detect is one that a landowner would want to follow up on. But those wells with very low levels of contamination, say in the, in the one coliform result or so, that might be due to sampling error and user contamination of the sample. The further up you go, the more bacteria you detect in a sample, the more likely that it is an environmental concern. One of the things that you could take away from this is that the colored dots, the red and the orange, they're not really clustered in any one area. They're kind of scattered around the county. And that's not surprising given what we know about Door County's sensitivity to groundwater contamination. We're not seeing any like cluster in one area. Next slide. Nitrate. It's the same setup that I've got for nitrate and then arsenic on the next slide. But basically, if you recall, the health standard for nitrate is 10 milligrams per liter. You can see that red dot or a couple of red dots that show where the higher levels of nitrate are. I think it's important here for us to recognize, though, that nearly a third of our wells had nitrate levels that were elevated above that natural background level. So while we didn't have a great percentage of them exceeding the health standard, we certainly do have wells that are within that elevated levels, especially those in the 5 to 10 milligram per liter range, those orange dots. And any well that's approaching that health standard is a cause for concern. So if I wanted to communicate one thing to you, it would be that we shouldn't discount nitrate contamination as an issue here in Door County, as well as bacteria, is something for us to be focused on. And finally, for arsenic, here again, you see the range of samples with green showing the lowest levels and increasing contamination contaminant levels shown by the deeper colored dots. The health standard here for arsenic is 10 micrograms per liter. It's important to remember that that's not milligrams per liter, that's an order of magnitude lower. We had one well exceeding that standard in Southern Door and other wells approaching the threshold. Important for those well owners to understand that arsenic is something that they should be paying attention to. And moving right along for our future plans, one of the things that we'll be talking about with UW Oshkosh for 2021 sampling is to collect information about the wells themselves for the people who are participating. Does the home have a treatment system? How old is the well? How is the well constructed? That helps us take a closer look and kind of pinpoint in, or helps Oshkosh really evaluate what are the factors that are leading to those wells that are showing contamination or elevated levels. We do have plans to share the data through the UW Stevens Point online well water quality viewer. This is a great interactive tool where you can, if you just Google Stevens Point well viewer, it'll come up for you. And you can really zoom in and out on areas of the state and look at data that's aggregated either by township or by county and see for a variety of parameters what those results are like. The last I had heard was that they had not yet uploaded our data into that well viewer. It takes time for them to be able to do that work, but that is our long-term plan for the samples that we collect through this program to have that available on that online viewer and accessible to the public. And we do plan to continue this fall with the countywide sampling. Like I said, I think we'll keep some of that streamlined program orientation. It's really been helpful. If you are looking for more information, if you have questions about what does bacteria mean for wells or what do these results mean, the Wisconsin Department of Natural Resources, if you go to their webpage and search private wells, water quality, you'll get a wealth of information. Particularly, they have brochures for individual parameters that are really a great resource for people who have questions. And finally, Oshkosh has their slides and presentation from their presentation available online as well. So with that,
We have
that-
several questions for you.
I'm sure you do.
We'll start with Laura.
Yeah,
Your mic again.
yeah, thank you. Just a couple of questions because of the data that you presented. And I will look further at that website that you had suggested. I've done that before. It's just been a while. So the question on E. coli and nitrate, when these tests come in, does it decipher right away between an animal versus human? And do you have those results? Nitrate, you had made the comment that it's naturally occurring and you get to a certain number, then you think it may be possibly otherwise. Do we have that past data to indicate that or to know that? Or how do you come to that conclusion? Just ciphering that out. And then my apologies if you had already presented the time. You said that this was collected in fall and you would like to do this potentially in spring. I just wanted to get specific range of months that these were collected in. Thank
Sure.
you.
So I'll take them in backwards order. So related to the time when we sampled, the way this program is structured is that we have everyone collecting their samples all in one weekend because that reduces some of the variability associated with weather and a lot of other factors. In 2019, the sampling was the first weekend of November, I believe, second, third, though don't quote me on that. And in the fall of 2019, it was in October, early October. And so we're looking to target our sampling in 2021, likewise in the October, November range, so that we start building that consistent year after year same sampling effort. Related to nitrate levels, it's generally accepted that above 2 milligrams per liter, that's when 2 milligrams a liter and less is kind of what you see in natural areas. It's just a rule of thumb. It isn't like a hard and fast paper that I can quote to you. As far as knowing whether or not the source of the nitrate is from what type of source it is, generally it's often the land use that's within that well's area. Wherever the water is hitting the ground and contributing to that well, that's going to be the source of the nitrates in that well. And so it's really hard to parse out because there's a lot of it depends related to that. But agriculture is a primary source of nitrate, especially across Wisconsin, across the state. Much of the nitrate contamination, especially very high levels in different parts of the state, is from agricultural land use. And then does the bacteria tell you if it's human or animal waste? It doesn't. So the total coliform result, that's a bacteria that's anywhere in the environment. That's just an indicator that there's potential for surface contamination to be entering that well. And even with the E. coli, that's the fecal indicator, that will tell you that it was a fecal matter that's in the water, but even that can't distinguish between human or animal. You really need a much more detailed analysis. And often the state will complete that sampling when there is a someone who has E. coli problems with their well, they can contact the state private well specialist and work with them to do that detailed kind of sampling. But unfortunately, our data just gives us an indication of susceptibility.
Right. So just to follow up, I think that's great. As we move forward and keep continuing collecting water samples, I think it's going to be important to back up if we say that that's a natural occurring or not. Where is that data to support that too? You know, as
Do you
we,
mean the
either
bacteria?
the nitrate, not knowing sure if that's just a given amount or percentage of 2%, and going forward to the type of testing,
This is,
clarifying.
so this type of sampling is sampling that is recommended for wells annually. It's a standard type of sampling. We're not doing anything out of the ordinary with the parameters that we are analyzing. It's how you look at the data, I think, is what you're getting at. So what does 2 milligrams per liter mean compared to 3? You know, it's more, that's not what we're after. We're more after looking to, is the water safe for the individual to drink? And that's the human health standard and the maximum contaminant level of 10. And then below that, if you're starting to creep up towards that 10 milligram per liter standard, at that point, people need to be aware that there's something going on with my water and be monitoring it to make sure that they understand what the quality of their water is.
David, Enigo?
First, I want to thank you. This is something that, despite being Door County, as generally the residents of any location would find useful. The continued annual checkups and that stuff, much like I feel about the aerial views that we do. It's expensive to do that for the mapping system, but I like seeing a consistent run through it. Forgive me if you've already answered this question. This is all private individuals participating for this report. Now, you don't necessarily know if it's coming from a business, but it's a sign-up application, right?
Yes.
Okay. So I know that various state departments and some federal require different entities throughout the state, in this case, Door County, to submit water samples occasionally as well. Many hotels, rental units, restaurants, commercial businesses. Is any of that data, is that something you might, because that's also routinely required, although we certainly don't have the same kind of control that you do it, doing it this way. Is that something that you correlate or tie into?
Absolutely. So the data that's available publicly through the DNR, we did summarize that and include it in our groundwater quality assessment section in the land and water plan that we just updated. So we do look at that data. This sampling with the twofold purpose of educating the public and building that database, we wanted to expand beyond that, but also focus on the private well owners, those people who don't understand that it's important or there's barriers. I know myself, I have a well and it's kind of tricky to get the water collected and in the mail to the lab at the right times because there's holding restrictions. It's got to be within 24 hours. It's got to arrive at the lab. And so what we're trying to do is remove some of those barriers to participation by making it easy for people, but also having that trigger of, oh, there's a well sampling program. It's time for me to, act, whether it be on that particular weekend or it just raises awareness of this is something I should do. One of my favorite things is that something that can happen at any time doesn't always happen at all. It happens at no time because there isn't a trigger for you to act. And so this provides that trigger for the public.
Yeah, I've personally had to collect samples. It cannot be fun to work through that process during the commercial side of the world. What level of participation between the years are repeat participants?
That is a good question and I cannot answer, but I will ask Oshkosh to give us that, how many people repeated.
Yeah, because you see these numbers and you don't know if it's the one person in that square is the same person those 3 years in a row, as opposed to a different well with a different sampling that might justify the change in numbers. Other than that, thank you.
Yeah, thanks.
Cara?
Thank you, Mr. Chairman. I was wondering about the intersect in data of poverty with the testing, like if there was a question of whether, like what kind of income, is there a cross-reference in that data? Because the information could be slanted by the variable of those who can afford to test or those with wealth or privilege. And I was also wondering if there was any initiative to reach out to communities that are more marginalized, and could we do a better job in that? Because I know that when you don't have, you know, the money to test, or you don't have the money to fix problems, you kind of don't want to know about them because you're like, it's better to remain ignorant. So I'm wondering about that intersect, I guess. Thank you for your answer.
That's a great question. Specifically reaching out to marginalized populations, that's something I would need to think about how we might accomplish that. So by providing a discounted rate, I think that that helps slightly with what you're getting at, but doesn't fully address that issue. We've targeted specific wells, randomly selecting within a section. We've sent mailings to people asking them to participate. And so that's been blind to the recipient intentionally by design. So I would need to think about how that might fit. We certainly do make the information publicly, and we've even asked for county board members to help us recruit people to participate. And so we'll be coming to you again this fall with that same request. And then related to the issue of having the resources to address the problem, I think that's a bigger question. I don't know that I could take that on right at this moment.
Dave Engelbert?
Okay, thank you. A question for you, Aaron. Sometimes constituents are concerned about having their well sampled if they know their well doesn't meet code, it's not deep enough, it's 4-inch, not 6, and that sort of thing. Is there information taken from this application that might have repercussions back to the landowner?
My first answer is no.
Okay, that's good.
Because we don't want to put any barriers in front of people for sampling. And so if they have concerns about providing information about their well, that's not actually on the sample test request right now. And if we were to add it, it would be a voluntary thing. I think it's important for us to know when we're looking at the data, whether or not the wells with issues are code compliant. I think that helps get at one of the questions that one could ask. You can say, is it because the wells are not properly constructed? To me, I come back to groundwater standards should be met regardless of well construction. And so that's just my personal opinion, that well construction helps helps provide that safe drinking water, but we want to know what the groundwater quality is independent of how that well is constructed. And any request to provide that information would be voluntary, and we don't see that information at Soil and Water.
Mm-hmm. I know there's instances where someone may have a 4-inch well and the well driller, the pump repair person says, I can't work on that 4-inch well anymore. It has to be a 6-inch. And whether that's true or not, I don't know personally, but that leads to people being reluctant to participate if something's reported. A second thing, not about this, Dave, but if I could ask that at the end of this presentation that you give some insight to the board about the flyover that was just done in the last couple of weeks. There's been a helicopter going through Southern Door, measuring soil depth, and it'd be interesting, I think, to the supervisors. Thank you.
Biz?
Thank you, Mr. Chairman. Sorry if I missed this, Aaron, but what is the cost to participate?
So last year in 2020, the cost to participate was, I believe, $30, and the county provided $15 additional incentive to get to the $45 lab cost.
Thank you.
Dave Anigal?
Supervisor Engelbert brought up, made me think of something. My well is drilled well over 300 feet. Personal decision. I wanted a deeper well. I didn't need it. I know there are wells that are 75 feet and less, a classic older well. And then some of them that are just the minimum because that's where they need to be, the 175. Where does the water quality get affected relative to that depth relative to surface?
That's such a difficult question to answer for Door County. I can't, because it all depends on which fractures your well is drawing the water from.
So it
And
is
so-
that variable.
So the
Okay.
standards are there for constructing the wells, but we know in Door County that if you have a contamination issue in your well, just going deeper doesn't necessarily resolve that issue. So-
Right, relative to the individual physical well itself, right? Thank you.
Joel?
Yeah, I guess I'll comment on a few things because I personally do well sampling monthly and I have for over 3 years. It's a pain in the butt, but it's a good thing. As far as what Mr. Or Dave ahead of me here was talking about, I understand there's reluctancy. I know people that have wells that are 25 feet deep, have some of the best water they've ever had. My well is 281 feet and that water is absolutely terrible, but it's clean, but it's, you know, it's hard, it's irony, that sort of thing. So I have a softener in my own place. But for anybody that doesn't know this, you know, you were mentioning the comment about mailing things in and getting it done on a timely fashion. That is very true. Door County has Ephraim and Bailey's Harbor both have testing facilities. That's where I use Ephraim. $25. You can take your own sample, take it there. You'll have the result the next day on how your water is. If anybody's curious, they're fantastic and they're spot on how to get stuff done. So there's a lot of factors, you know, involved in this. Obviously, and David mentioned about well construction. He's right when it comes to if you have a well problem. If you call a plumber to do any work on your well and they see that it's not a coated well of 6 inches or bigger, they are required to report it to the DNR. Even though the well is perfect, they can't work on it because the DNR will most likely tell you need to get a 6-inch well. So the 4s are becoming obsolete, even though they're fantastic water. So there's a lot of factors involved. So there probably is a lot of reluctance on people wanting to get things done for the fear of having to put a $20,000 well in, allegedly, potentially. So, but from a perspective of testing, I would shoot a shout out to Ephraim because they're fantastic. You don't got to worry about the mail, post office screwing something up, sending it to Madison. So, because it's time sensitive, I understand that. So, shout out to Ephraim.
Susan?
I just wondered, you know, when you get the data and you compare it, can you envision a situation where you did see a cluster of a concern of some sort? That Soil and Water would need to contact people and talk to them about, or do you see it as just, let's just see what's there and this is the data? But I just, you know, we've had pretty good luck, I think, in the county, but maybe there could be a time. Does that even
So,
make sense?
yeah, I have a couple of thoughts related to that. One is Oshkosh talks directly with the participants in this particular study. I'm going to take it in a global direction after. So related to this particular study, Oshkosh is, if somebody has questions, they're able to answer for those individual well owners. I think if we saw a real tight cluster of E. coli hits, I would ask them to have the landowners give us permission to look into that, because I think that is really important for us to follow up on the source. It's not enough to just identify there's an issue. I want to help remedy that issue. And then from a global perspective, I think that we do rely on the individual people to reach out to the state, or most often is to the state, and then we can become involved in assisting with investigating what are the sources of a contamination issue. We certainly are willing to do that, and we do work with public health in certain situations to communicate with landowners when we have significant events that make it certainly worthwhile for somebody to be paying attention to their water quality of their wells.
Thank you.
Anybody else? Any more questions?
So
Thank you,
do,
Aaron.
do you want to, the helicopter thing? Or two
Sure,
seconds?
go ahead.
2 seconds.
2
We're
seconds.
running short of time, but yeah.
So anyone who had seen the helicopter with the big thing hanging below it, flying back and forth across southern Door County, the Wisconsin Natural History Survey, Geologic and Natural History Survey, was doing a investigation of depth to bedrock. And so they have put out a press release. There's more information online available, but it certainly was a site. Thank you so much for your time and attention.
Thank you, Aaron. Okay. Resolution 2021-08, authorization application for acceptance of financial assistance for the kayak launch at Robert M. Carmody County Park.
I thought we were here for the presentation, right? I thought that the human services were here.
Okay.
Sorry.
No, fine, we'll back up. We're gonna back up. Sorry.
Okay.
Yeah, we're just gonna stop. We're gonna continue on with our special reports. Next will be Door County Department of Health and Human Services Racial Equality and Diversity Team's presentation. Good morning, welcome. Or good afternoon and welcome.
Good morning, everybody, or afternoon now, I guess. All right, my name is Brandon Gross. I'm with the Children and Families Unit, here with the Door County Health and Human Services.
And I'm Jess Holland, and I'm a social worker with Adult Protective Services. I've worked for the county for 7.5 years. And thank you for having us here to talk about our new, relatively new group that's going on in Health and Human Services. So, let's see. The Racial Equity and Diversity Team, it's also called, we call it READ. We formed in June of 2020, and our first meeting was in July. Right now we have about 10 members in our group. And our vision is that Door County Health and Human Services is welcoming, safe, and fair for all. Our mission is that we strive to educate ourselves and our colleagues about systemic racism, build connections with communities and people of color, confront racism and discrimination wherever it exists in our organization and through courageous conversations and bold actions, and to transform our organization's workforce, policies, practices to ensure justice and equity for everyone. So, maybe I should back up quickly. Brant and I talked about saying why we each had joined the team. And I guess, I can go first. Simply stated, I felt compelled to do more to address racial inequity, but also because of an instance with my son. He's 9 right now, but a couple years ago, we were at the farmer's market walking around, and there was a Black woman, and he looked at me and he goes, "I think she's Chinese." And I thought, well, she could be. Maybe, that wasn't my first reaction, but it made me realize that race as a topic is really avoided. Even in my family where I think that we talk about it and equity and how things might not be equal, that was the only conclusion my son could jump to when he saw somebody that was Black. So even though we consider ourselves informed, we can still do more. So diversity. Essentially, that is what makes us each different. It can be racial, ethnic, socioeconomic, gender identity, physical abilities. So as our group looks at diversity, we are learning about and acknowledging how all of these different forms of diversity intersect, and how these different traits and circumstances affect how we're perceived and how we're treated, and how those traits affect everyone's experiences in the world, both interpersonally, but then also within bigger systems.
And so along with diversity, the other half of our name and kind of our mission is equity. So in discussing equity, we're talking about being just, impartial, and fair. And a big part of that is understanding the difference between equity and equality. And I think on our next slide here, there's a nice visualization. I don't know if anybody who's seen this picture before, it's a pretty popular one, kind of looking over the fence. And if not, everyone is given, everyone in the first picture is given an equal opportunity to look over the fence, but not everyone gets the view. And the second one, it kind of displays equity, where people are given what they need to be able to view over the fence. So, and then in systemic equity, what we're talking about is kind of what our focus is more on, working with right now, the Department of Health and Human Services, how we can work on systemic equity. And now kind of what that is in a nutshell, that's a real hot button issue. If you watched a lot of news lately, it's the word systemic and systemic equity and racism are very heavily used. It's a very hot topic right now, but basically it's just all the interrelated elements that work together to support and sustain social justice. So that's kind of in a nutshell what the systemic equity would be. So it is, how can the Department of Health and Human Services ensure that our service provided are equitable, and how we have our how we handle our employees is equitable. And then, yeah, so going back into diversity.
Yeah, so as you can see, diversity is having a seat at the table, inclusion is having a voice, and belonging is having that voice be heard. So the READ team's vision is for everyone, clients and employees, to feel like they belong. It's really that simple, and to be treated like they belong too. So racial equity and diversity is a focus for Health and Human Services because it really is integral to our mission and our vision. So our mission for Health and Human Services: prevent, promote, protect, working together to support the health and well-being of our community. And our vision is to become the best human service agency in the state with excellent customer service where staff enjoy coming to work. And again, we want that to be for everybody. So the READ team's mission and values are also consistent with core values of being person-centered and culturally responsive. Everyone who's a social worker or a therapist or a nurse working with the department and in other helping roles have their own sets of ethical standards that we have to follow, and being racially equitable and diverse falls within those sets of standards. We know that being informed and acting on that information about racial equity is trauma informed, and that's one of our core pillars in Health and Human Services. And we also know that systemic inequalities and racial disparities exist within our areas of practice. So, for example, you can see that people of color are overrepresented in child protection and foster systems. And they're also more likely to suffer the negative impacts of many health indicators, yet they're underrepresented in terms of access and utilization.
And then so going into why now, as you can see, the pictures we have up here are from some pretty hotly debated national topics that have come in: Breonna Taylor and George Floyd, their deaths in the spring that resulted in several protests that some turned into riots, and really kind of brought to the forefront a lot of these issues. And that really brings into why I was interested in joining the team. My wife and I recently moved up to Door County about 2 years ago now. It was one of those things where, we come up on vacation and didn't want to go home, so we didn't. And we had actually moved up. We had lived in Kenosha, Wisconsin for a while, down in southeast Wisconsin, and lived in eastern Illinois. And so seeing what happened in Kenosha, from up here, it was kind of hard for us because, places we'd see that we would go out to dinner or, hang out, and we saw what was happening down there. So really why the READ team got together was to try and get ahead of the curve. Fortunately, up here in Door County, we really haven't had to deal with the brunt of many of these issues. We've been fortunate enough to stay, isolated from it. But it's really important to address it and get on top of it, and make sure that we're at the forefront of it. So, because these things can happen anywhere. I would have never guessed that in Kenosha that any of that would have happened when I lived there. I mean, it was unfathomable. And then to see it kind of happen overnight, this is just something that we feel strongly that we need to address and engage in and make sure that we are at the forefront in doing everything that we can. And then a statistic that we put up here is related to coronavirus, because as you all know nowadays, it's that kind of is involved in everything and all decision making. And I think this kind of displays where our group is at right now, because we have the set of information. If you see the numbers on the left are active or coronavirus cases, then on the right is population, and kind of the disparities on how minority groups are overrepresented in contracting the virus. Now, what does that mean? We don't really know. We don't know, what those numbers mean. Is it, that minority groups get tested more, under tested? We're not really sure. So that's really one of our main, what we're going to try and do right now is we're trying to educate ourselves and look at what these numbers actually mean and how they apply to us.
So, in general, what we're doing in our team, like I said, we formed in July. We had our first meeting July 15th of last year. And first, we're focusing on educating ourselves through study and discussion. So we've read books, we've listened to podcasts, we've watched movies, we've gone to some trainings. But we wanted to make sure that we had enough information that we were comfortable sharing that with our colleagues. It's a hard topic to talk about because nobody wants to say the wrong thing. But we're all going to say the wrong thing at some point. We kind of all had to accept that. And that's part of the work that goes on. We have partnered with Just Door County for consultation, and we've also started connecting with other organizations in Northeast Wisconsin that focus on racial equity, action, and education. We're sending out messages to our department regularly for people to learn and then reflect on what racial equity means and how we are involved in that system. We're examining our own internal demographic information for our service areas and for our staff, and then considering any changes or outreach, service delivery, things that we can control within our department.
And then just getting more specific as far as what trainings we've done and what we are doing. We partnered with United Way of Door County, which has been a great resource, great community partner. So we had 48 staff and community members attend a training presented by them. So that was kind of the initial first step. That was us dipping our toes into the water, starting to spread the word that these trainings were coming. And then in February, the NWTC, we've contracted with them to do a training for all agency staff. So that's kind of the next step is to train the entire Department of Health and Human Services. And then we're also going to try and do some information gathering and see where we're at as far as viewpoints and comfortability with participating in these trainings. And then we're also going to be attending Disability, Equity, and Inclusivity Level 1 certification certificate program, from UWGB. So again, that is really just us educating ourselves and realizing, this isn't a knee-jerk thing that we can do. We can't assume that we have all the answers because really we have very few. And hopefully these trainings will kind of enlighten and then proceed with us in the next steps and kind of where we're going. So what we've learned already, because like Jess said, we've been around since June, so we're about 6 months in. So we've kind of learned about the implicit biases, the stereotypes that are kind of there, the unconscious stuff. We've learned that is more of a prevalent issue than necessarily the overt racism. When somebody says what racism looks like, I think myself and a lot of people personally, you think of cross burnings, you think of, the KKK and hoods and real, strong concrete symbols of racism. But we've also found that there are things that many of us do that are unconscious and kind of not something we intend to do or something we set out to be, but just it's just part of a society today, unfortunately. Also, the aspect of white privilege, and a lot of these things are just difficult to discuss because it is hard to kind of put our heads around it, and the privilege that some of us enjoy more than others. So building awarenesses of these biases is something that we realize is very much necessary, and it's a hard thing to do. And there's no silver bullet. There's no actionable thing that we can think of right now. So that's kind of where we're at. And we also have come across that it's the responsibility of white people. We can't rely on people of color to educate us and tell us what needs to be done. That is something that we need to take on our own. And then the systemic racism, again, it comes back to that systemic idea that I was talking about earlier. It's how it wasn't done by accident. That, you know, when we talk about law enforcement, housing, education, healthcare, all of these things, sometimes can be systems set in place that, you know, have been around for decades and decades and decades, if not centuries, and is just now kind of being addressed in the system. So again, this is all things that we are really just trying to understand and comprehend and really get our heads around at first, and that's kind of where we're at. And I think everyone on the team kind of, we weren't aware of the scope. We weren't aware of kind of everybody's say in the whole process. So we are still just trying to educate ourselves and trying to get, like I said, as good a grasp on this as we can.
So like that last bullet point says on the previous side, you know, we've been conditioned to think that only bad people are racist, but really racism is a matter of, it's not a matter of bad intentions, but rather negative outcomes and experiences for people of color. So if we go to the next slide again, or you can see in your packet, but there is a, excuse me, Mr. Paddock, would you go to the next slide, please? Thank you. So this is the last slide too, but so this is a visual that we've used to try and gauge where we are in this process. You know, we've learned that it's not enough to not be racist because the societal systems that we live in, we must actively be anti-racist. It's work and it's worth it, you know? So at on your own time or at leisure right now, you can sort of gauge how you feel in all these different places and acknowledge that it's uncomfortable really to be in any of the positions. But when you think about what is an equitable society, where do you want to be? Where do you want most people to be on this continuum? So we understand that you, as a board, may be getting some more education, or at least there's discussion of that. In the meantime, in the packet, there is information that was compiled from the YWCA in Green Bay. It has lists of movies and podcasts and books and articles. And we as a group have found it really helpful for some direction on reflection and learning. And we thank you so much for listening to us in your already long meeting.
Thank you very much. We do have a question.
Okay,
Cara?
awesome. Thank you so much. I just wanted to question very gently the use of the words fortunately and isolation as far as the county goes, because I think it's important to recognize anywhere we are that there's a reason why there are no Black people in this room. There's a reason why, and it has to do with white violence and white supremacy. So I think that those were little triggering words that I heard when we talked about the isolation and stuff. And, you know, all of the things throughout history, like sundown towns and everything, like there's a reason why we don't have the population that other counties might. So I wanted to recognize that and what was stolen from people who weren't able to utilize this area of the state. Thank you.
And again, yeah, when I did say isolate, unfortunately, I didn't mean to, you know, down talk any of the issues or anything like that. And the isolation part of it, you know, that was just again, you know, isolated as far as, you know, the county is geographically just kind of set aside from things. So yeah, I didn't mean to by any means try to downplay it or anything like that.
We have some more questions. Vinny?
Thank you for all the work that your department is doing on this and for creating the team for racial equality and diversity. And I'm excited to learn more about it, you know, in the future as your progress goes on, and then how we can do this with other, you know, departments and entities in the county. And I was just wondering if you could elaborate a little bit more, if you know, about what Just Door is, like as a group, and what they do in the county, or any things they have contributed to your understanding of the issue in the county in particular, if you have that information. Thank you.
Yeah, Just Door County was a really active group for a while, and then sort of, some of their board members were moved out of their roles, so it has just been reignited, so to say, especially around the same time that we formed our group. They got a new director, co-directors actually took over, Nikki and Damian Howard. And I think some of what they're doing right now is also trying to decide how they are going to act as a group. But essentially, a lot of what they're doing is education. They've been doing book drives and distributing them for both children and adults to learn more about racial inequity in action. And they've met with us a few times just to help us decide where to go with our group and tell us what their opinion is, I guess.
Thank you.
Thanks.
Laura?
Yeah, thank you. I did notice,
Your mic?
I'll get it after the next meeting, that's the third time. About leaving out age as a diversity, was, I know on your slide you had defined diversity as quite a few things on our slide, which is 124. My experience working with elderly for a good portion of my life and in various different cultures and countries in this world, I find age is to be very different, not just in generations, but of the culture of how we have traditions. And I find that interesting, especially with the larger boomers, as we say, and then this large movement on a governmental level, trying to speak to government, is that there is much large movement of younger people coming into office of elected officials. So I find that there is large diversity there because there's a bigger gap between who has been working and who is coming in to work. So I would like to see that included in your definition. I know you put et cetera because diversity is a lot of things. So I appreciate that. And then also just a comment on, I think for the last year of, with all this work that everyone's doing and things that I'm reading on a national level of resources, and we had something given to us today, WCA, which is really nice to see that organization doing that. However this comes about in this discussion can be very emotional to some people or not. But racism is on both sides. It's not one color versus one color. And that, I think, if anything, when I hear people give speeches on this, that's bothersome to me because it may be more one than the other, but it's two-sided. So I think when we define and we give presentation, we need to be conscientious about that, especially if we want people to participate and learn to become educated. If people hear certain language, they put walls up, and we don't want that. So, so that was my feedback, but I really appreciate some nice information, and it's nice to see more resources and education come forward. Thank you.
Yeah, we do want buy-in, of course, from everyone. It impacts everybody. And related to age, you know, I think that this visual was taken from the internet somewhere, so it's not an official definition, but I appreciate you pointing that out. Like I said, we've learned about all the intersectionality of every sort of trait that people have, and some of them affect people's privilege or lack of privilege more than others. So it is good to look at all of them as a whole. Yeah.
All right, thank you very much.
Thank you.
Appreciate it. Okay, we're going to take another 10-minute recess.
See, that's why. Oh, I touched it too. Oh.